It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. My topic today is a rehabilitation hospital team approach to rehabilitation. And here with me is Dr. Lebron, Medical Director for Healthsouth Sea Pines Rehabilitation Hospital. Welcome, Dr. Lebron.
Good morning. Thank you.
And I want to set the stage correct. Roughly 3 months ago, when I awakened in the intensive care unit at Wistoff Hospital, and I had that tube stuck down my throat, and my hands restrained. I wasn't going to pull a tube out, but they still had my hand restrained. Mm-hmm. I wondered why. I've had so many things happen to me, and why did this happen? I had a stroke 3 months ago. They moved me after my period of time at Wistoff. They moved me here to Healthsouth Sea Pines. You were the first doctor I talked to. And I said to you, I want to make something positive happen out of my suffering a stroke. What can other people learn from what happened to me? And you were most encouraging because you said to me, you thought that putting down what happened to me in a television series of shows would help people. Do you remember that?
I do remember what our discussion on that time. And I think it's very important because time in this situation is brain, is what they say. And the faster that we react to this problem, I think the faster that we can recuperate or recover or get better after the injury. So I believe that it's a matter of reacting fast, going to look for help, and to get the adequate treatment also.
Yeah. You know, we have hospitals and we have rehabilitation facilities.
Correct.
But what makes Healthsouth Sea Pines Rehabilitation Hospital different from all these other places that treat stroke and falls victims? What makes you all special here, doctor?
Interesting that you asked that question. Rehabilitation has different levels. There are different levels of intensity of the rehab program, depending on how severe the stroke is how much of the help you're gonna require at the beginning. By that I mean we have acute inpatient rehabilitation, we have subacute rehabilitation, or in other terms, skilled nursing facilities. We have home health services, and we have outpatient also rehabilitation. The acute inpatient rehabilitation requires medical necessity together with a functional impairment. There's certain guidelines that the patient needs to meet in order to come to a facility that is a rehabilitation hospital. Then you have another level below that is skilled nursing facilities. Skilled nursing facilities, you have to have a functional decline also, but the medical necessity is not as intense, so the patient is more stable and can be seen by a physician, but not as often as a rehabilitation hospital. The next level is home health, which means that the patient is medically stable and can go home with family, and they can get the therapies at home. Once they become better, they can go to the next level, which is outpatient, and they can complete their rehabilitation program that way.
Okay. I suffered what is called a hemorrhagic stroke. Is that correct?
Yes, that's correct.
Okay. What makes the type of stroke I suffered something that should be treated in a place like Healthsouth Sea Pines?
Well, different things. Number one, the medical necessity of monitoring your blood pressure. There are some comorbidities that require a physician to see you after the stroke and continue to monitor and see that everything was up to par and that there wasn't any decline. In the case of a bleed, the probability that you can have worsening of that bleed or re-bleed is high. So somebody needs to monitor your mental status, your strength on the affected side, and any other signs or symptoms of worsening, like a headache or seizures. There are different types of stroke, include the hemorrhagic stroke. There is also an ischemic stroke, and there is which is an embolization also, and there's also intracranial hemorrhages.
But mine was a bleed outside the brain.
Yes.
I recently heard that hospitals have a new technique where they can go into the brain and they can break up a stroke, a blockage. Is that correct?
In part, yes. When you have an embolization where there's a blood clot that is obstructing the blood flow to a certain area of the brain, there is a treatment called TPA, tissue plasminogen activator. It's an enzyme that you can use in that case, and it will break the blood clot. The important thing about that is the window period that you have to use that. Patient have to be within the 6-hour period of the symptoms starting so you can use that. If you're outside that window, then you cannot use that treatment.
That's using the drug, right?
Yes.
But this is what my understanding is, is something new, that it's like an instrument they can go in. Have you heard of that?
Yes, and they can also do that, but also is within a certain window period.
Oh, okay. All right.
And what happens is, if you don't do it in that certain window period, then the risk of bleeding are higher. So
okay, but in my case, you had the additional complication of the fact that I was on Coumadin.
yes.
So that's what makes, to me, when you talk about stroke, and you mentioned the importance of getting to the intensive care unit quickly,
Yes.
so the doctors can assess your situation. But the follow-on is extremely important too. And I guess I didn't realize the importance of what you and Dr. Kearney were looking at when you observed me sometimes 2 and 3 times a day.
Mm-hmm.
So you have here what I call it the rehab team approach,
Yes.
where you, as a medical director, you have all these other assets that you assess every case, and you decide how you're going to treat them. And I ask you a question about what kind of a doctor you were. You said you're a medical doctor, but you're a physiatrist?
Physiatrist.
Physiatrist, I got it right.
Yes.
But that has to do a little bit more with medications. You deal with medications more than maybe a family doctor would, correct?
In some aspects, yes. Because of stroke being a neurologic condition, there are certain aspects of medicine that internal medicine or a family doctor might not be as related. And talking about that, I can just mention an example: spasticity. When people become weak on one side because of a stroke, the way that the body can react is forming a spasm on those muscles. There comes medications like baclofen or muscle relaxant can help you start relaxing the muscles so the therapist can work with you.
An interesting topic, Dr. Lebron, is the subject of the use of medicines and medication in hospitals, and how they would do it in a rehabilitation facility, but how it's completely different, in my opinion, in a rehabilitation hospital. Perhaps you could enumerate on that a little bit for our viewing audience, because it is important.
Well, after stroke, there are different pain generators that we can have. We can have starting from headaches, from nerve pain, muscle pain, and joint pain. So depending on what is the description of the quality of the pain, and that's, in your case, I had to ask you, what area is it hurting? Is it a pain that is located in a certain area? Does it travel elsewhere? And from the information that you gave me, I can pick up from a certain line of pain medication, like joint pain or muscle pain or neuropathic pain, which different medications will address the different types.
Yep, and I have all of them.
Yes. Some of them.
But that's really what makes a rehabilitation hospital different. When I was in the hospital, the doctors saw me, different disciplines saw me for different things. Then they moved me here, and you and Dr. Kearney knew what my problem was, so you were able to focus more on that. And then with the way the medications were administered, not only did you ask me questions, but the nurses also asked me questions.
Correct.
Which makes it a little different. In describing a team approach like you use here at Healthsouth Sea Pines, how does that different from just a regular rehabilitation facility? What makes you so much different?
Well, the rehab approach definitely is different from our specialty than from the different other specialties that see a stroke patient. A stroke patient can be seen by an internal medicine doctor because you are going to have some comorbidities together with your stroke. The main doctor that's going to see you is a neurologist. In our side, on the rehab side, our approach, we're going to treat the stroke on a different way, because stroke is not only a matter of the injury to the brain, it affects the person in different ways. It can start with depression. Is one of the things that me as a rehab doctor see a lot on the stroke patient. We see problems with headaches, problems with seizures. So we have to address that side also of the stroke. We also see problems with bowel and bladder management. After the stroke, the patient who used to be perfectly normal on those aspects now is having trouble with urinary retention or having trouble with constipation. Another matter is the weakness on one side. The speech is another aspect that we have also to address. That is where not only the physician touches the patient, that's where rehab becomes more of a team approach to the patient. We have different types of therapy that will address different functional declines. Like in the case of the physical part, physical therapy is the one who is going to work on the weakness on the side, on the starting to move again the upper limb or the lower limb. Speech is going to address the problems with the speech. If the patient is having trouble with what is called aphasia, which is an incapability of the patient to communicate. The speech therapists also work with cognition. So they do exercise and they analyze what is it that the mental status of the patient and the change that has happened from the beginning till the situation that they currently face. They also work with swallowing issues. Like every other part of the body that has muscles, the vocal cords is also a muscle. So that also gets affected. One side can become paralyzed, the other one is working right, but the patient now is having trouble with swallowing. Could also be a problem with the tongue or some of the cranial nerves in the oropharyngeal stages of swallowing. So they will work with exercises and some other treatments. Occupational therapy is the third aspect on the therapy side. And what they do is they make sure that the activities of daily living are being addressed. So this patient that is going to be discharged soon home is going to be ready to tie their shoes, put their socks on, dress their lower body. They can toilet themselves, groom themselves, and to be ready to go back to home in the most part independently. Our goal is usually to send the patient independently.
It was interesting. We had a time where we could talk and we weren't on camera. And you said something about there's one aspect of therapy that's even more important to the patient than walking.
Yes.
And I was very surprised. And it's a very personal area. But when you think about rehabilitation, you do address so many personal aspects like toileting and showering, but you said that one of the greatest accomplishments was the ability for the person to be able to wipe themselves after a bowel movement.
And yes. I have seen it that a patient who is walking about 200 feet might have the trouble of going home with the family because they cannot do those things. which in part might sound silly, but it's the reality. And that is one of the things that we work here on them. So because independence is very important both for the family and the patient and for their mental status also, you know.
One thing, we have what we call modesty and false modesty. And one of the things I found here at Healthsouth Sea Pines was what I really wanted to shower. I just wanted to get clean. And the nurse informed me that she was going to give me a shower. And they're used to it. I'm not used to it. And yes. She was a very nice looking lady. And I said, "You're going to give me a shower?" And she says, "Yes." I said, well, I didn't respond right away. She says, "Don't worry about it, Mr. Steckler." She says, "I'm married." I said, "But you're not married to me." And but when you go to a rehabilitation hospital, you have to learn what's important.
Yes.
If you let the therapist and the doctors do their job, I think you'll come out a lot better in the long run, and you'll come out more healed, if that's a good terminology. And your chief nurse, your head nurse, commented to me that one of the most knowledgeable things that you do here at Healthsouth Sea Pines is you do everything you can through your team approach to motivate a person to want to accomplish on their own.
Correct.
And I think that's so important. Dr. Lebron, since Healthsouth Sea Pines is a rehabilitation hospital, you said that one of your bread and butter services here is rehabilitation of stroke victims.
Correct.
As a medical doctor, and being the medical director here at Healthsouth Sea Pine, please, for our viewing audience, give your perspective on stroke, risk factors, and lifestyle that we lead that can help cause strokes. What do we do bad, and how can we change it?
There are certain things that we cannot change about stroke, like age-related strokes. That is one of the risk factors that we cannot modify. We're going to get older, so stroke, as we get older, we're more prone to get strokes.
Okay.
Blood pressure, control of the blood pressure is another one of the main things that we need to watch for. Diabetes is another one. Now, it has shown that people who has diabetes, having a tight glycemic control doesn't inhibit or doesn't stop stroke on happening. So you can have a stroke even if you have good glycemic control. Having just the condition of diabetes will cause the risk factor to be there for you. Cholesterol is another thing that we can modify. How active we are on our daily basis is another thing. Exercise is always good. Good diet that is low on sodium will also be something healthy for you. There are other things that I was discussing before, certain conditions that if you have them make you more prone. Diabetes, I already mentioned. Migraines is a condition that is related to people having strokes.
Migraine headaches?
Migraine headaches is people who get migraine headaches are more prone to having a stroke. Having coronary artery disease. When we have coronary artery disease, that means that we have atherosclerosis in our arteries on the heart. If we have atherosclerosis on our heart, probably the other arteries on the body will also have plaques. So that means that our carotid arteries can also be clogged or having plaques of atherosclerosis. That will also make you more prone to have a stroke. Atrial fibrillation is a well-known condition that can give you a stroke. And there are some other conditions that can also make you more prone.
I was reading recently that in order to control migraine headaches, there's a new plastic band that they put around the head and tighten around the skull, and it has electrical impulses in it.
Interesting.
Could that type of thing?
What I was saying before was even the diabetic that has perfect glycemic control can be more prone than the regular population to have a stroke. And I believe just because of having the migraine history, that's what puts you in the bad position of getting a stroke. Not as much if you have the migraine itself under control. That's my understanding.
Yeah. As the medical director for a rehabilitation hospital, what are some of the greatest impediments that you see people develop themselves? And I'm thinking here of weight, failure to maintain strength. What are some of those types of risk factors that we could do better about adjusting our lifestyles?
Definitely. Sedentarism is your worst enemy. Somebody who doesn't exercise, poor diet, not visiting the doctor. I see a lot of people, young people, and by young I mean 40s and 50s, who get a stroke, and when you ask them, they've never visited the doctor. So having all of those risk factors under control helps you live longer and healthier and postpone these things like strokes and things like that happening to you on a younger age, which is devastating.
If a person, can genetics play a very important part in whether or not a person would be a stroke risk?
In the sense of conditions like aneurysms, if you're prone by genetics to having aneurysms in your brain, then you're more prone to have an intracranial hemorrhage and then get a stroke. In that sense, yes, but they haven't found still a gene that will make you prone to having strokes directly.
But in terms of overall health, if a person did smart things about their food intake, amount of intake, exercise, keeping themselves active, not just sitting around, laying on, becoming a couch potato, and doing things that would keep them energized, those are some of the things that we can do very inexpensively to mitigate against risk of stroke.
That's correct. And those are the things that you can control in order for you to live a healthy lifestyle and a healthy life.
Okay. As a doctor, when you see patients come here, do you find it's difficult to motivate people to work hard at their exercises? Or how do you go about doing that?
For the most part, no. People, they want to work out, and people value their independence. So they understand that if they're clear, their mind is clear, they understand that you're here to help them. You can also see the other side. If the condition gets the best out of you and you're depressed, because let's be real, this is a life-changing situation, not only for the patient, but also for the family, who now have to adjust in helping their relative get back on track, and they want to see them happy and looking forward to living every day. So depression is very common. In that case, we can use antidepressive medications, and even the medications that are used for conditions like ADHD or ADD, trying to get those spirits up, trying to get the patient more energetic. Medications like Ritalin, Adderall, those medications have been used to get the patient motivated and participating. The most important part is trying to get their mind out of what just happened, which is difficult because it's like I said, a life-changing situation. But once they can concentrate in participating with therapy, they can then get better.
I would think that the ability for on-site doctor appearances to closely follow what happens after a stroke and seeing the condition of the patient both physically and mentally would play a great part in how you would medicate that person so that the person could help themselves achieve more.
I think so.
And I think that there's stress and depression that enters into it a great deal, doesn't it?
Definitely. And I remember we had the conversation many times, and I asked you, how do you feel your mood is doing? Lucky for us, your mood was always great and you were very positive. And I think it has to do also if you can see progress. If you can see yourself progressing every day, it won't take a toll as much as somebody who doesn't see any improvement and doesn't see any progress.
Yeah. I subsequently was able to tell people after I left Sea Pines that what hurt me a lot was in the therapy sessions to see people that wanted to do something but simply did not have the strength, and you could see it in their face that they just couldn't do it. But at the same time, you'd see other patients encouraging the people to do, and it makes a difference.
I think it has to do also with everybody trying to get better, and that's another good thing about having people rehabbing together. It's like a team approach, and everybody tries to pick up the other person and encourage them.
Yep. In your consultations on your patient's progress, do you often see clues that are brought forth by the different therapists and how you could adjust medications?
Definitely. Not only in the chart, we can see the different notes from the other specialists. We also have what is called a team conference every week. What we do over there is the physician together with the rehabilitation team, physical therapy, occupational therapy, and speech therapists, together with the nursing staff, we all meet and everybody brings information about what is it that we need to work on in our different disciplines. I will bring any medical issues that we're working on. Physical therapy is going to tell us what are they finding barriers or lack of improvement in certain areas. And that way we can come up with a date and an estimate of how long this person is going to need here to stay with us.
And I think that would be one of the greatest differences in what Sea Pines can bring to the rehabilitation process.
Excellent.
You agree?
I do agree. I think it's excellent.
Thank you, Dr. Lebron. I appreciate having you here today. And I want to thank you, viewer, for watching today's episode of Focus on Seniors. If you have questions or comments, please call us at 321-473-7770 for more information on senior care and resources. Visit our website, helpingseniors.brevard.com. Be sure to listen to Focus on Seniors on radio station 1300 AM WMEL every Thursday morning at 9 a.m. and look for us in your Florida Today Health Section newspaper every Thursday. I'm Joe Steckler, and I thank you for joining us today for Focus on Seniors. And thank you, Dr. Lebron.
Thank you.
For being here. Thank you very much.